Okay, so today we're gonna be changing or performing a sterile wound change. I'm gonna check outside the room first and see the patient's name, Mr. Jones. There's no extra PPE necessary. We come back in. I am really sure. All right, hello, Mr. Jones. Today I'm gonna be performing a sterile wound change on you. So first, I'm just gonna have to ask you, what is your name and date of birth? Name and date of birth.
Mr. Jones, August 9th, 1945.
Yep. All right, I'm gonna make sure that matches your ID band. All right. All good. And Mr. Jones, are you allergic to any pain medications, latex, food, anything of the sort?
Nope.
All right. And then, are you feeling any pain today or right now?
No pain.
All right. So if the patient was feeling pain, you would use some non-pharmacological pain medication, wait for that to take its effect, and come back later. All right, so now I am going to raise the bed. All right. And with closing gloves, I'm going to assess your wound. Okay, so I'm going to apply this bath blanket on you too, so you have some extra privacy and a little bit of warmth as well. Right there, and now I'm going to expose the wound. Okay, and what I'm doing is I'm going to be careful be careful of any tubes or lines. Make sure I don't break those. Great. If you're ready, I'm going to use the push-pull method to take off the bandage. And if I was struggling to take off the bandage, I would use a sterile saline solution and make sure that I could pull off the bandage. All right, so I'm going to pull off the bandage from the outside and pull up. Okay, I'm going to assess the bandage. It's using the taco method. That's going to be type, amount, color, and odor. And I see that there's a little bit of clear drainage on the wound, but it is odorless. Okay, so I'm going to get rid of the bandage. And I'm going to assess the wound itself. It sees there are some sutures on the wound, and there is a drain, but there is no swelling, erythema, or edema present. So now I'm going to measure the wound. Centimeters. I see it's going to be 7 centimeters in length, and then width it's going to be about 0.4 centimeters. And now I will begin to set up my tape, and then after that I will do my sterile field. So that will take just a bit, so bear with me, Mr. Jones. Okay. And then I'm going to be sure to label one of my 5 pieces of tape with my initials, the date, and the time that I put. we don't labeled it. So now I'm going to perform hand hygiene again and then begin to set up my sterile field. Okay, so first I'm going to begin with my sterile drape. Open the package. Take out the sterile. Okay, let me grab the pointers. Make sure that the sterile drape does not touch me, and then I'm going to that. Alright, now I'm going to put the rest of the materials on my sterile drape. So I will first start with my abdominal pad. Make sure that they're all closest to the middle of the drape as possible to maintain my sterile field. So make sure that lays in the trash can. I'm going to grab my open that up. Trash can. And then I'm going to grab my gauze pad. Open that up. Alright, now I'm going to get my jelly, make sure that it's also within my sterile field, but close to my patient so I'm not reaching over my sterile field with the medication. So I'm going to jellies. The 6 inches above, drop that on. There. And now I've got all my materials ready. I'm going to perform hand hygiene one more time and don my sterile. Alright, so now that I've got everything ready in my sterile field, I can now move around my materials in my sterile field and organize them how I want to. So I'll make sure my abdominal pad is spread out with the blue line on top. Excuse me. Set these up. Make sure everything is within my sterile field. So take okay, first I'm going to apply my medication. When I do apply my medication, I'm going to go top down in one singular line. I'm going to maintain my sterile field and drop it in garbage. And now I'm going to apply my gauze pads. Okay, and now I'm going to apply my abdominal pad, and I'm going to hold it down with one hand and grab the tape with my other hand. So we're going to Make sure that's all good. And then I'm going to use my last piece of tape with the label so that the next nurse or me in the future knows exactly who changed it and what, at what time. Okay, so now that the bandage has been changed, I'm going to make sure Mr. Jones is okay. I hope you're doing okay, Mr. Jones. We're about to finish up. I'm going to cover him back up here. I'm going to come up in here. I'm going to remove this back blanket if you do not mind. Backs up here. Okay. And as I'm lowering the bed, I'm going to ask Mr. Jones if there's anything else I can do for him. I'm going to let him know that I will be back at least once during the shift to check on his wound. And then I'll make sure the collar is also in place just in case he needs anything. Hopefully this bed goes down. Okay, and I will make sure to clean up my area and remove my glove and once again perform hand hygiene one more time before I leave the room. So I can wrap all this up. Added my sterile gloves. Garbage for hand hygiene. And I hope, Mr. Jones, you have a good day.